Hi, Brad Kropp again, Medical Director of OKC Kids Urology here in Oklahoma City. And again, we're talking about life after bladder exstrophy closure. The previous video, we just recapped, kind of what to look forward to and think about, after the successful bladder closure, and then up to about 5 or 6, 7 years. Now what I'd like to talk about is that it's wonderful and great if your child has gained urinary continence and is now able to urinate on their own. But in order to gain continence, it may require surgery. So in order to gain continence, and remember, continence is the ability to void or urinate or pee, void spontaneously, and be able to control it. Now, there is dry, and that's a little bit different, okay? So being dry is usually surgically where you've tightened up the bladder neck area and you then empty with a catheter. So there's a little bit of difference between being continent and being dry type thing. This is, again, what I would always call our golden trophy. It occurs about 25% of the complete bladder repairs, or the modern stage repair. Being dry, again, that's going to usually then require some type of surgery. So when do we want to get dry? I think Dr. Reiner, my partner, is going to be discussing some of these issues about when is it appropriate to be dry. But we usually think about between the ages of 4 and 18, 20. It's really when the family and the child is ready to be dry. And that's going to depend on what do we have to do. Well, in order to be dry, we need several different things. So in order to be dry, we have to have a big bladder. So that's number 1. Number 2, we need a tight sphincter. Okay? Now number 3, we need to be able to get the urine out. Okay. So these 3 things are going to be required in order to be dry of urine. So this is measured based on, some people will require a bladder enlargement. So again, if we measure the bladder, it's either native bladder is big enough. So no bladder enlargement is going to be required. Bladder augmentation is not going to be required. However, if your bladder too small, well, then it's going to need to be made bigger. And the way we do that is we use a piece of the small intestine. So we take a piece of the patient's small intestine and we add it onto the bladder. So again, here's our bladder neck, here's our bladder, and we open it up. We take a little piece of intestine, okay, and we open that up, and then we make a little cap for this. And so this comes over here, and then we put a little cap on top of the bladder to make it bigger. Okay, so now we've made it bigger. Well, we have to have a tight sphincter, because if this is an open channel, well, sometimes we can narrow it with the bladder neck repair, or sometimes that bladder neck repair has already been done a year or 2 previously. So sometimes it needs to be tightened up a little bit tighter, or sometimes we actually have to close off the bladder neck. So we have to disconnect it in order that the urine does not come out the urethra and it's closed off. Then we make the bladder bigger, or if it's big enough, we don't have to do that. Now we got to get the urine out. So everybody knows about the Mitrophanoff or the catheterizable stoma or the appendicovesicostomy. And again, all those 3 things are exactly the same. It's basically taking a appendix or a piece of small intestine and connecting it, making a new urethra. So instead of the urine leaking out this way, we close that off or we tighten it up. And then we take the appendix and we bring it up to a new belly button or just below the belly button. We build a one-way valve on that side of it so it doesn't leak. And then the child will then pass his or her catheter into the bladder every 3 to 4 hours every time they need to empty their bladder. So again, getting the urine out involves and again, generically we call that a catheterizable stoma. And again, it can be called an APV, a Mitrofanov, a catheterizable stoma. So that's how we make the children dry on this aspect, the difference between continence and dry. And again, that's what we would like to shoot for in the future. We're going to talk about, we can get into more details of the procedure if you want, and just let me know and we can make a video. So thanks.